Since our nation's creation, agriculture has been and remains the world's largest industry and an essential sector of the United States economy. Farmers used to rely on family, locally hired hands, slave labor, and neighbors to meet the labor demands of each harvest season. As crop production grew over the years, migratory and seasonal farm workers became a critical component in filling labor demands and became a necessity for our nation's economy. Farm workers lived and worked under hazardous, unsanitary conditions while surviving on meager wages with poor access to education, welfare, and health care. Public awareness of farm workers and the conditions they lived in surged during the 1960s. This was evident after the documentary Harvest of Shame from American broadcast journalist and war correspondent Edward R. Murrow aired nationwide on Thanksgiving Day. The film detailed the exploitation of migrant farm workers by large agribusiness and highlighted their poor living and working conditions. In addition to the documentary, the farm labor movement of the 1960s had a great impact on the public's awareness and the lives of farm workers. As a result of the growing awareness of the plight of farm workers, a Senate subcommittee on migratory labor was charged with developing a comprehensive bill to address a variety of migrant labor concerns. The bill passed both houses of Congress and was signed into law by President John F. Kennedy in September of 1962 as the Migrant Health Act. The Migrant Health program developed under this bill was designed to allocate funds, facilitate interagency cooperation, disseminate information, and monitor the health status of migrant farm workers. It led to the launch of migrant health centers across the country who still continue to meet the challenge by providing health care to migratory and seasonal farm workers throughout the United States. We now celebrate 60 years since this program was implemented. Today, farm workers continue to be essential to the economy and our nation's food source, but still face a number of social determinants of health that impact their health outcomes. To address these factors, farm workers need to remain at the forefront of our community and a priority population for health centers. It is also critical for community organizations to work together to address these issues and meet the needs of the farm worker community. As we look to the future of the Migrant Health Program, we invite you to join us in strengthening our collective efforts and advocating for farm worker families to have access to quality health care by signing up to the Agricultural Worker Access Campaign. The Agricultural Worker Access Campaign was launched in 2015 as a joint effort by the National Center for Farmworker Health and the National Association of Community Health Centers to increase access to care for farm worker families through the implementation of innovative strategies and the engagement of strategic partners to foster local and regional collaborations. Learn more about how you can contribute to this initiative by visiting our website and downloading tools and resources to share with others in your community. You can also help by contributing to the Call for Health program, a nationwide toll-free health information and referral service for farm workers and their families. Your contributions to Call for Health go directly to farm workers needing assistance and support for healthcare needs. For more information and to stay connected with the National Center for Farmworker Health, visit our website at www.ncfh.org. Thank you for supporting our mission of improving the health of farmworker families across the country.